Hello, I'm Dr. Maskey.
Hi, how are you?
I'm fine.
Yeah, okay.
I don't mind talking to you on Skype, but I don't think in this hospital we're allowed to record. So I'm going to ask you not to be recording.
That's fine, yes. It's okay. Thank you.
So I think when I look through the notes, because I'm now taking over from the last hospitalist who was done yesterday. So I just want to be sure I know who I'm talking to. But David and Isaac, who I can't really see, and then what's your daughter's name?
Maritza or Elizabeth.
You can't see me. I'm waving. Can
Isaac
you see
is there.
that?
All I see is your hand, Isaac. I'm so sorry.
Look at my face
Bring
now.
it closer.
Okay?
No, you've reversed it now. I'm focused and you're not.
Oh, that's me.
You can only see your hand.
Can you see me now? And perhaps it's probably because of the cellular connection on the tablet.
No, it's because you have me on the screen. I don't know. It looks
No,
like
it's not because.
Make
So,
it shrink me.
whether or not we can get your mom home
Yes.
today or tomorrow.
And
And the
we
chest
want
case sounds
Jesus.
good, but she will need ongoing medications and in particular puffers.
Yes, that she is fully aware of that, and actually,
And ask what
and
I'm
she
going
seeks medical assistance when which is required. That is why she admitted herself voluntarily at the beginning of this, because she was suffering an infection, and then after she had a fever and was in a delirium, your fully trained psychiatrist misdiagnosed the delirium as dementia, which we are taking issue with and pursuing other legal recourse. However, she needs to be released ASAP.
So I'm trying to work through that with you right now. I'm aware there's been some disagreement about various diagnoses. I'm trying to make arrangements for you to go home with David. You're on a number of puffers.
Yes.
And one puffer in particular must be taken 4 times a day. And right now, I think this is absolutely critical because the air quality here is absolutely terrible. The smoke is making people come into hospital.
Yes.
So
I think you should put it on the prescription order as needed, because as the forest fire abates, the air atmosphere will become more readily breathable, and she will not need to take the puffers, which have adverse side effects to her physical health.
So Isaac, where are you calling me from?
Toronto.
Right, and are you a medical person?
I am competent. I am the most competent in this.
Are you a medical person? Because what you're doing is you're telling me what to do as a doctor. And what I'm going to do, I'm going to treat this patient appropriately.
Yes.
She needs this puffers 4 times a day, and there's a few more medications, and then she needs to follow up with the family doctor. And when the family doctor feels that she's stable, then you guys can all make a choice and an informed decision about what to do with the puffers. But right now, I don't have a crystal ball, and I think that she needs to have it 4 times a day, and that's what I'm going to write.
Should be, just to be safe on your side, should be 4 times or as needed.
Actually, the medication that she's got, she requires 4 times a day because that's how this medication is prescribed. She's also getting a medication at night.
Okay, please disclose to me the medication.
She's getting Risperidone at night.
Why is it? What is the purpose?
1 milligram.
1 milligram?
Yes.
And why is she being prescribed an antipsychotic?
Because there have been concerns, and it is now stable. If I could speak and answer your question, this would go along a little bit easier. But every time you ask me a question and I try to answer it, you interrupt.
Continue.
She's getting Risperidone because it's helped stabilize against this sense that there are people above her
Have you been
in
in
another floor,
Have you been
hearing voices.
at night?
Again, you're not here in Victoria, and I am.
Being in her apartment because you are now
Okay,
to take issue with that.
okay,
But
let me talk. My mom has legitimate issues. Her apartment has been broken into. She has had burglaries. This is not a delusion. I take offense that if someone is burglarized many times, that she has a mental problem. So that is
So I not meant to be offensive, Elizabeth. It's
You are
actually meant to
being
be helpful because that same sense has been here.
no,
And
No, it's just when she came into the emergency. There
No.
has been no problem
what do you
throughout
think?
the.
I think Gail's been here throughout. We also have the social worker here.
I mean, my understanding from the nurse's charting is that it's been kind of ongoing, even in hospital here, David.
That's what I understood.
Well, because she has been here for as an emergency because of her health. As her health got better, physical health, she had no symptoms. It's just due to.
excuse me, because she was having delirium as a result of the sepsis, and you know what happens in delirium, correct? So thank you for rectifying her medical condition of sepsis, but I really
You keep it short. Yeah, because for example, she has had robberies. Her fur coat was stolen. Money has been stolen. It is natural for someone to not be calm if they sleep. She doesn't have sleeping issues.
and she was being
Risperidone.
interrupted by nurses checking
Okay,
her every night,
Yeah.
and that disturbs her sleep. And then, of course, she wakes from a deep slumber, so she is a bit disoriented. Correct.
So, like, and yeah, we have issues
And
with
your
that.
unit manager even admitted she is fine during the day. It is only at night when she is asleep and we disturb her that she appears to be confused and disoriented. You want someone to walk into your house and wake you up in the middle of the night and say, "Are you confused?" Like, please understand.
Hilda, you have to go to the bathroom?
Yes.
Okay. I have one question before you go to the bathroom, and we
Okay.
need clarity on this. Who is the person that the emergency should call as your next of kin? Is it David, or is it your daughter and son-in-law in Ontario?
Let me translate.
Up to my daughter and my son.
Al Isaac estaba diciendo.
Okay. So we need to get a good phone number here because right now your mom has to go to the bathroom.
Yes.
I'm going to tell you that I would like to send her home with David today. So somehow I've found myself in this conversation where I perceive that you think I'm being difficult.
Yes.
I'm not. I'm merely trying to follow through with the physicians who've been caring for her because that's what we do here as a team. And then get her to her family doctor, who I already called this morning, because further changes in her medication, which have made her stable right now, should be continued. We do this in everybody. We wean it down to the bare minimum, get a person home on the medications that have helped them. And then once you're in home and in the community, in the next week, she can go in and see Dr. Jerome, and between them, they can decide what they should continue. So I was trying to explain what she's been getting, and we want this discharge to be successful. So last time she went home, the occupational therapist was not happy that she was stable, and she was brought back.
Occupational therapist is not a medical doctor.
A very safe
right
and effective discharge. What are you saying now, Isaac?
I'm saying that the occupational therapist was out of the scope of his professional authority. He was rumor mongering because I have received accounts of what transpired when they attended without due notice,
Be quick, sir.
and it was
So,
no.
sorry, did you want his phone number for contact? Because I think this decision is made. Who's going to be next of kin? Did you want it?
The decision's made that they're going to be the next of kin.
It's Isaac.
Yes.
Not
So I need to have Isaac's last name.
It's
Yeah.
Isaac.
Von Hillier, BON, capital HILLIER. First
Yeah,
name,
and first name is Isaac.
yes, ISAAC. AAC.
Good. And what's your phone number, Isaac?
Number is 416-841-1831. And the email address...
You broke up for a minute.
Okay.
841-1831.
Thank
you.
841-1831.
Yes.
Area code 416.
Yes.
I got that.
Now, and I would also have notes on the file, my email address for...
No, I don't want your email address, Isaac.
On the file.
We would use email, we would use a telephone. So is this the only telephone?
That's the best telephone to contact with.
Great. So what I'm going to do is send your mom home with David. If she was, she told me this morning she felt ready to go. Is that correct?
She's been telling you that for the past.
With David. With a follow-up with the family doctor, you'll have to phone and make an appointment, David, for next week. And the medicines I'm giving will be sufficient for a month.
Yes.
And sometime in that month, between you guys and the family doctor, if there's a change to be made, that can be done with the family doctor.
Okay, and prior to her being discharged, I needed to be formally recognized that I am the next of kin with authority for the records regarding this admission. That makes it easier for the course of action we're taking on our side. Thank you.
Gail?
So Isaac, I can put you down on the chart as the next of kin, the temporary substitute decision maker. But as I said earlier, you need to do. Can I finish my thought, Isaac, please?
Just so you know what you need.
Okay,
thank you.
Okay, Isaac, can I talk now? Is that okay?
Okay, thank you.
Yes, go ahead.
Go ahead.
So in order for you to access any health records,
I understand
you have to have it formal. The health authority cannot formally do that. Only a lawyer or a notary can formally make you the direct health representative for your mother-in-law.
No.
We can put you down as a temporary substitute decision maker, but that is not a formal process.
No,
you must go to a lawyer or a notary to formalize it.
I understand. But I'm saying I want you guys to have a standing note on her admission, just so if this happens, say, tonight, before I'm able to get an authorization, we won't go through this kind of deal. So I will be contacted immediately on any readmission to Royal Jubilee Hospital.
Yeah, fair enough, Isaac. We'll make sure it's on the electronic record that you're the contact for her.
Thank you.
Okay.
Yeah, that's not a problem. And then, David, have you brought your mom to Dr. Jerome before?
No, I haven't. But she told me she's been there, and it was where it stems from. She didn't get a proper test done for the patient. She had some medication that she was taking.
David,
But she had to
we'll address that.
Well, there are very few family doctors taking patients in the city.
Yeah.
She has a family doctor, and I think what you need to do is phone today because it's a long weekend coming up to get the appointment for early next week so that you can start to let them know how you're feeling better. In the meantime, I expect that if you use those puffers 4 times a day, the air is still very bad.
Like years to times, I think.
We had to change it unless you would like to pay for the other ones. I can't get those ones that are 2 times a day covered, and they're very expensive. So I'm suggesting that we make it reasonable because the other one is 4 times a day, but it will be covered. And then the steroid puffer, the fluticasone is 2 times a day. So you can do that without having any extra cost to you. Would that be better? What are you going to do?
Yeah.
That's right. So I have the list of the medications here. There's also a pill for blood pressure and pulse called bisoprolol. There's one called rivaroxaban, which we give for people as a blood thinner when you have atrial fibrillation so that she doesn't get a stroke. And vitamin B12 should be given in injection form. It's next due on September 17th. I'm giving you this piece of paper, by the way.
Thank you.
So I think we need to know what pharmacy to send this to, because we can fax it there so that you can get it picked up.
I don't know. It said farmacias al lado del doctor.
We'll actually just sec.
No, para todas.
Hilda can take it home and she will.
Here, Isaac.
Yes.
¿Cuál farmacia al lado del doctor?
It is more convenient for them to take it to the pharmacy themselves.
It's closer
So
to them.
Yes.
So you want it to London Drugs? You can take this to London Drugs, but I want you to keep your own copy. So I'm trying to be helpful.
Yeah,
We can fax it there ahead of time to London Drugs on Yates. And then they can start to prepare it before you go. I'm only trying to be helpful.
I understand. Thank you. I appreciate that. And I apologize for any brusque nature. The previous physicians have been hostile.
Cook Street.
London Drugs is not on
Yeah.
Cook Street.
It's okay. She'll take it home and we'll follow up with the pharmacy. We'll follow.
London Drugs.
Ve a la farmacia.
Follow up with the pharmacy, but
Sorry, you know what? You've got to acknowledge that there are your mother-in-law and David are talking here, and I can't give you.
It seems like you are pressuring them because they have not reached a decision about which pharmacy to use.
Hold on a
You are
second.
rushing them to make a decision without due consideration. So please heed my advice and allow them to take it home, and then we will contact the pharmacy and bring it.
Get home,
Thank you.
because it's 4 times a day. So I think I'm going to treat you like I treat everybody else, with respect, to be helpful, to get the medication you need, have it ready, so you don't have to go and wait for a long time in a pharmacy. One pharmacy that is
We're
close.
going to call beforehand and have them have it ready. However, we are unsure at this point which pharmacy to use, and you are being hostile in a sense because you are pressuring her to make a quick decision without due consideration.
I am not actually pressuring her, Isaac. I'm
Yes,
trying
you
very
are.
hard to listen to your mother-in-law and to your brother-in-law.
I'm not sure if you are, though.
London Drugs by Yates.
It is. It's
Yeah.
a big store, right?
Yeah.
They'll be very helpful there. Okay, so we've decided on London Drugs in Yates because that's very convenient for them. And I will fax it, but I'll also give you this copy. And Dr. Jerome will also have the copy. Now, there's one more thing. I would recommend, and in fact, I'm absolutely certain that this is required, that the seniors outreach team come and check in on you to make sure that you're all good with your breathing, because your breathing got very poorly here. You came in with the urine infection, and then the breathing became a problem.
She came in with a compound complaint. Excuse me.
Pardon me?
She came with a complaint of several symptoms. The urinary infection was part of it. The breathing was also part of it.
Right. I think when I...
You are
just
implying that she is incapable of recognizing her own illness. So please do not do that.
You know what? I'm not doing anything disrespectful. I'm just telling you that there were a number of things that were going wrong, and it's important to
have
make...
them all addressed. Please understand.
Yeah. Is there any other question you have, Elizabeth, in particular? Do you have a question?
Well, I'm really concerned that she's been, because my mom has, I know she snores. Sometimes she may talk in her sleep, but that does not mean to say that she has dementia. Her memory is excellent. She remembers all facts, all dates, people she meets. So I disagree with that.
Except your prescribed medication is actually memory loss is one of the listed adverse side effects. So that is part of the problem here. She is able to care for herself better under her own.
She doesn't need a seniors outreach program because we call her.
You can give her the contact information. We will
I think your mother is the most important person. What are you saying?
I'm thinking that right is not necessary to take it because this has damaged my memory, and then I don't know anything. It's not possible to do that. I not simply dementia.
No, I don't think anybody here is saying that you have dementia. I want you to be clear on
But she's just saying that Risperidone, she's seeing the side effects.
Risperidone has impacts on one's balance vestibularly, and it also has heart effects. And she is actually, if you're up to date on your health alerts, adverse reaction alerts from Health Canada, you should know that she's actually not supposed to be receiving Risperidone. Would you like me to give you the document?
Yeah. So that's a choice that you make, not take. But when I read through the notes, what I understand is not that there's been a concern about dementia, but there was actually, I think my sentence, please, Isaac. Thank you. There was a concern, particularly in the early part of the admission, but even throughout, that there were delusions that persisted and actually got helped by the Risperidone. Now, I told you before, I'm not changing the medicine that the previous physicians and the specialists have said would be important for stability. That can be decided between the seniors outreach team, your mom, because she is not demented. I don't think she's demented, and her family doctor. So his responsibility is going to go to the family doctor.
Well, go ahead.
So,
pardon me?
If you want to feel personally liable, you can go ahead and disregard the caution I'm giving you. This is specifically regarding the restriction of the dementia indication on Risperidone, dated February 18th, 2015, issued by Health Canada. The identification number is RA-43797, and it has specifically said that it is only to be used for people with severe dementia and the Alzheimer's type, unresponsive to non-pharmacological approaches, and when there's the risk of harm to self or others. There is not, so you will not prescribe that, please. It will be, if you insist, it will be on a as-needed basis.
So, Isaac, I understand that your mother would like you to be this temporary decision maker, but right now,
and not part of this conference.
My sentence. The important person here is your mom,
and
mother-in-law.
She understands what exactly you're saying.
To keep that pill at night in case you get any of these visions or senses that there's somebody out to get you, and then you review it with your family doctor. You've been getting it here, and you're pretty stable today.
Yeah, because she is being
or would you like to use as needed.
And you,
Isaac, I'm trying to talk to the patient here.
Sorry.
I don't see any visions. I don't hear anything as usual. They work.
We do take issue with the diagnosis.
They work.
So would you like to have that in case? Because it did help to take those things away.
I think she only has that if she has acute pain, which she would almost.
You don't take it.
You don't take it for pain. You take it for hallucinations, and she does not have hallucinations. There is a concern. They do live in a dangerous neighborhood.
Elizabeth, I'm so sorry. David's talking right now, and I can only do one thing at a time.
So all that led up to it, there was nothing of any paranoia, nothing of any worry, nothing.
So would you like me to leave that there on an as-needed basis because it did help the paranoia when she was here? I think that's why.
No. We'll set up a bad
Elizabeth,
record.
What you say?
So she can speak with her physician and consult with her family.
The thing is that I'm going to help her go get another apartment because she lives in a dangerous neighborhood. The reason she was having disturbed sleep is because she has they have been broken into many times, and the superintendent did not want to change the lock. So I disagree with the Risperidone. It is not going to help. What she needs is a better place to live, like a more.
And the Risperidone will set up.
There's a lot of discussion here, Elizabeth. The apartment may be an issue.
No,
finding a new apartment might be an issue. But David said that she didn't have some trouble until she became ill. I think from judging from the chart, and Gail, who's the social worker here, who's seen her throughout, that symptom lasted a long time. So what the diagnosis has been is delusional disorder, not yet diagnosed. And the treatment
she had an infection.
Leave it there so that she can take it on an as-needed basis if she gets that symptom. And
okay, if you so wish.
Toronto, you're not handy. So David needs to know that there is something there if there's distress. And you know what? You can always come back, right?
I know.
Yeah.
Yes, so my concern is about where she has problem going to the washroom or other problems, which is her breathing and all that. Because I know now that she has some problems with her kidney or liver.
Yeah. So now, when we've gone through everything, actually, her breathing is very good today. I've already checked it. The kidney and liver, I believe, are all stabilized, at least judging from the notes and from the lab
test. You not give me the same. I take it here, those buffers.
I can't because they're very expensive and they are not covered.
On one thing.
So that's why I have to give you a puffer 4 times a day. It's similar. It'll help your breathing. Honestly, you should do it.
Less potency.
Pardon?
Is less potency.
It's a different medicine.
Yeah.
So it's 4 times a day, and the system will cover it. The other one is very pricey. Right now, with the air being bad, I really want you to take it 4 times a day because I don't want your breathing to get bad.
Oh, if you could please put that as a
what is the causation?
Basis, because I don't want other people to pressure her into.
I can't hear you. Your mom's talking.
Sure. Stay very sleepy, but I can't because it's very dry, very, ¿cómo se dice? Amortiguado, numb. My lips, my tongue, and my throat. It's like
when was that?
When I take the aspirin.
Oh, that's the Risperidone, the dry mouth she's talking about.
I have to wait.
The Risperidone, that's the side effect of the Risperidone.
She's talking about the dry mouth symptom that wakes her up and just gives her like sleep apnea.
I prefer not to take it.
The
vision or the noises is for sure. My neighbors make it upstairs, make it that side.
I hear you. I hear you honestly. I said
she has no problem with that. We're
gonna make that just on the side if you did need it.
Okay. Well, my buffers are on an as-needed basis because she has noticed in the past that there is an adverse effect if she takes them too. They begin to be less effective, and she has other bad effects.
Isaac, who are you talking to?
I had the volume low, so it was hard to.
All right, can you hear me?
What you said.
Okay. The problem is that the puffer should be on an as-needed basis because she has noted in the past that when she takes it regularly, it decreases in efficacy and she experiences unwanted side effects. So if that could be on an as-needed basis in order to preserve the quality and efficacy of your treatment protocol.
So Isaac, I'm going to have to leave now. I'm going to fax this to London Drugs on Yates. I'm going to leave the puffers 4 times a day because that is the way that they are used. That is the way this medicine is used. And I am not going to put it on an as-needed basis in the middle of a smoky situation where even people with good breathing are having trouble.
I understand that.
when
Are
she
you
sees
implying
the
that she is
doctor,
not aware of her ability to breathe? Because she is able to recognize that, oh, I should take a puffer now because I'm starting to show shortness of breath. So I will take that.
some of the puffers that we use are rescue medicines like that, and some of them are meant to be used to prevent people from feeling shortness of breath. So these are not rescue kinds of puffers. So I'm going to prescribe it as it should be 4 times a day. That's the science. I'm going to fax this to the London Drugs on Yates, and you can follow up with Dr. Jerome. I've tried to put a call out, and I'll put another call out to him. The seniors outreach nurse will come and check on you. And I hope that your breathing stays good and that the smoke goes away. And then by and by, maybe you don't need the puffers as often as I'm giving you right now because you've been sick. Okay?
So can I have a question?
Oh, wait a minute. You're saying that she only needs to take the buffers
Isaac,
when
David's talking right now. Isaac, David's talking right now.
Maybe as
prescription, ma'am.
yes.
Yeah.
So then, how do you deem her as mentally stable, or do you still, or is she still under like?
No, she's not. That lapsed on Saturday.
Oh, I think because she's better from all the infections.
That lapsed on Saturday.
That is
Yeah.
Talking.
They're
you
not
don't
addressing
get all the time, then you can take it if
So I
there are
mean-
these delusions.
Right,
Because
that's what
what we've been concerned about is the paranoia, the sense that things are out there.
So I
gonna
think
hurt
you
you.
recognize it's.
She does not have a paranoia. She is not. Oh my goodness. Do you not have an elderly mother? If a person is elderly, has had a hard life, they
And
have
has
some.
been traumatized by nurses coming into the room all the time or neighbors being loud. She
But the
will
mental
be a
process.
bit
She does take.
cautious, precautious, shall we say.
She needs it. She will take it.
So
Leonidas, why don't you say that she does not need the Risperidone? Mamá, diga que no necesita el Risperidone. Ellos están diciendo que usted tiene delusiones, está imaginando cosas. Dígale que no necesita esa medicina Risperidone.
Categorized as mental illness.
Mamá, ¿por qué está callada? ¿Por qué está de
doesn't
acuerdo?
want to fall in.
That's what he would want to address.
So you can address that with her family doctor and with the seniors.
Oh, I don't want to even be listed or to be prescribed because
Diga que no
that
está de
will set up a
acuerdo
bad
del
pattern.
Risperidone,
If she
mamá.
wishes to, she notices the problems.
Your mom again, she
Hold on a
asked a good
second.
question and I can't answer her and then have a conversation with you. I'm so sorry about that. I'm very difficult. You need to follow up with your family doctor because this is just 1 month in your life. But you need somebody who's looking at all of these
Sure, I
medications.
need that,
It
doctor,
was
but
not 1 month, it
never
was 2
talk.
months. You
Just next week. And then you make a plan with him when you're going to go again. For example, you probably should go in October and get your flu shot. So I think next week, and then you meet him in October in a couple of months, and you get your flu shot because you should, because you're breathing.
just eat healthy and have a good immune system to prevent.
That is family doctor, not with me. Right now, I'm just.
You should not be giving this advice because you do not have, as you
Hold on. She's talking to you.
you have admitted that Hilda Esperanza Roscoe is fully capable